Pharma Leaders 8th Annual Awards 2015. The 8th Annual Pharmaceutical Leadership Summit and Business Leadership Awards was held in Mumbai at Hotel Hilton, where more than 300 top leaders of the healthcare industry had gathered to be a part of this historic debate on Pharma Leaders 2015 Brand India Winning.
Hello and welcome to the 8th Annual Pharmaceutical Leadership Summit and Business Leadership Awards 2015. In the Glenmark Pharmaceuticals Limited, as Vice President in India, Asia and Africa. Many of you probably are not aware that Mr. Krishna Kumar, who is popularly known as KK, is also a cricket commentator and speaks extensively on cricket, and he regularly writes columns in various newspapers and travels extensively worldwide. Welcome to the 8th Annual Pharmaceutical Leadership Summit and Pharma Leaders Business Leadership Awards 2015. Innovation has always successfully addressed several emerging demands in various walks of life, more so in the pharmaceutical and healthcare industry.
Pharma Leaders brought together the leaders under one platform. The Leadership Platform Summit in the afternoon session debated crucial topics such as healthcare and challenges of India pharma industry.
Enzymes are used for all many things. But what they are exactly? We know serratiopeptidase, we know trypsin, we know pancreatin, and we use them for normal treatment. So what exactly these enzyme supplements are? So enzyme supplements are unique combination of enzyme to ensure broad spectrum via synergism. So when we use a monoenzyme formulation, it is basically for a treatment of particular site. But here, when we are talking about the systemic enzyme supplement, I can say SES, for specifically for a broader perspective, which can flow throughout your body and give you the desired healing effect.
Cosmetic surgery in the West was very, very aggressively marketed. Marketed saying, pretty much rightly saying, no side effects. There are actually no side effects of cosmetic surgery. There may be complications, there may be difficult problems, a bad scar, a bad result, non-healing wound, not a good result. But there are no side effects that can kill you. Why does hair transplant work? To give you a little idea, just a minute or so. When anybody loses hair, you lose hair in the front and the middle. Nobody loses in the back. The back hair are permanent. If I take hair from there and plant it anywhere, it will stay for life. And grow like normal hair, need haircuts, never fall, comb them, oil them, shampoo them, and they stay for the rest of your life. They are unlicensed workers who are working without supervision. You don't know who's doing what for you. And the rampant is there in the hair transplant industry. I'll give you a funny story. Some technicians have learned hair transplant and they make a team. And they will go to a doctor, sir, you catch a patient, you charge 50,000, give us 20,000, we'll do hair transplant, you don't do anything. So this quack or a doctor who's an MBBS or whatever, gets the patient, you are bald, I'll get you hair. Chalo bhaiya, we'll do a hair transplant, you pay so much. That team of quacks of technicians comes, do the hair transplant, go away. Such teams are rampant in Ludhiana, in Chandigarh, now it's in Bombay, in Pune, in Ahmedabad. This has to be stopped.
India has arrived on planet Earth, and healthcare and pharma sector of India is really at prime time. I think we are really growing, and I think it's something which we should be very proud of. I think the Make in India, Made in India brand is really surviving. I think up till now, I will just tell you an example of diabetes. We had the largest number of diabetes population in 2011, and we lost our first rank to China. And currently our aim of all our diabetes societies, in fact every diabetologist has his own society, okay, is to actually be the diabetes care capital of the world.
Of course, we have quite a few gaps that people talk about: shortage of doctors, shortage of nurses. Let's be realistic. If tomorrow we're going to double the number of medical schools, double the number of PG seats, and so on, we are not going to fix this problem for the next 20 years. So that's not the solution.
The Hippocratic Oath contains the main things, and I hope I'm pronouncing it correctly. Primum non nocere. First, do not harm. This is the first principle taught to doctors, and this is the first principle taught to us in medical ethics. Do not harm. help, help, but do not harm. Okay, and this we look at to create and overcome the challenges and delights of creating a world-class medical healthcare system.
So how does a medical student enter the medical college? Again, a multiple choice questions. He mucks up 10 types of guides, and there you have scoring 540 marks out of 540, and there will be hundreds of them. Majority of them got 100% simply because of the examination system. So you mug up these multiple choice questions, and you get 100 out of 100. The newspapers have these photos, and in every state, this is a routine every March, April, and May. That means something seriously wrong with our basic education system. We don't want to be regulated. We don't want to be regimented. If there is one solution we need, our country needs, is quality education, and it be regimented.
The highlight of the seminar was a panel discussion on will innovations in India drive the next generation of global cosmetics dermatology trends, where the country's top doctors and industry debated on the latest innovations in the cosmetic dermatology field.
The point that I want to make it here, where in this Pharma Leaders platform, where more than 300 pharmaceutical company owners, healthcare leaders, medical professionals who will be attending this conference will be debating on a topic which we kept it as a brand, as Pharma Leaders 2015, Brand India Winning.
When I think of global, I'm not thinking of just the US or Europe. There are so many other countries like South America, West Indies, almost the whole of Africa, and they're all looking up to India.
The field of cosmetic dermatology is so complex. Especially for me, actually, I'm fascinated with this actually, because a lot of people want, they want to look young and they want to look handsome. A lot of things are happening. Spas are being attached to this cosmetic industry. Why the treatment process are different from one to another? Why there is not a universal practice?
Nowadays, the treatment is so much commercial, and the commercial angle coming in with the spas and the big houses has really ruined the scene. And at least Indians, the lawsuits are much
Are
less.
you of the, sorry to interrupt, are you of the opinion that the spas and all the beauty centers that is being attached to the cosmetic industry should not be there?
They should be regulated. I'm not saying they should not be there.
Clinical Establishment Act, the CEA, which I think is luckily going to be implemented at some point soon, which basically, the crux of it is that it's going to differentiate qualified MBBS, dermatologists,
Maybe
or
you can
any other faculty.
Let's be lucky
from-
first.
Okay,
Let's
yes.
be lucky first. Let the government do it.
I agree.
The whole world looks up to us. The number of patients that individually all of us treat or jointly together as an association, it's very rare to have this kind of numbers anywhere in the globe. The quality of Indian doctors is always considered superior in the global standards today. As we know, more than 30% doctors in UK or in USA are of Indian origin.
This is the profession which is emerging very fast. Whether you like it or not, this is going to be the next profession in India which will drive in healthcare innovations. And this is moving very fast.
Here's what the important dignitaries and delegates had to say about the event.
This is the 8th annual edition of Pharma Leaders Super Brands, which we call it as something which is as the Oscars of the Indian healthcare industry. इसमें ये होता है इंडियन फार्मा कंपनीज में, जैसे हेल्थकेयर इंडस्ट्री को हम कवर करते हैं, वहाँ पे कोई चीज़ों को हम ऐसे देखते हैं जो कि नेग्लेक्ट हो चुका है. So this is the area which we are focusing on it. जैसे there are issues like healthcare insurance, something related to medical tourism, something on healthcare innovations, which is actually a missing link in the Indian pharmaceutical industry.
The panel discussion was very enlightening. बहुत अच्छा लगा, बहुत जानकारी मिली, और ये भी लगा कि I think the doctors need to really come up and invest some time and energy in communicating the right message to people. अगर डॉक्टर्स आगे आके लोगों को बताएंगे कि सच क्या है, क्या क्या ट्रीटमेंट्स है, ऑथेंटिक ट्रीटमेंट्स क्या है, तभी लोगों को पता चलेगा. So some effort and some time for the right communication is very important.
Today we are focusing, in fact we have a discussion about skincare innovations in India, how wide the India market is growing in cosmetic dermatology, and how far we are par on excellence with the global industries when you compare to the Indian industry. And today I'm glad that I'm also going to receive the award for the cosmetic dermatology as an innovative cosmetic dermatologist of India 2015. Thank you.
This event is actually a very interesting event. It's an event where specialities from multiple areas providing healthcare, pharma industry, and of course the hospital industry are involved. Hopefully, the take-home message would be that we need to wake up. If India has to stand up in the world stage as a number one country, then we need to correct our education. We need to certainly correct our medical education. We are producing lots of doctors, but majority of them are mediocres. We need to produce world-class doctors.
Here the event like basically Pharma Leadership 8th annual function and innovative awards function. Basically they are targeting the youth and all the healthcare fraternity to look at the healthcare preventive manners, and then in that way it is really good.
This event has been till now has been a very wonderful event, excellent gathering of speakers, very well thought out presentations, enriching ideas, and at least I have been able to, my mind is working overtime now, thinking of all the things which is information which is flowing. So I think it's a great thing. So I wish this event a great success.
Right now, this event, which is Pharma Leaders 2015, I think it's a very good platform for all the doctors in the country to come and present themselves, and also it creates a lot of awareness amongst public about the actuality or entity of a doctor. Whatever myth has been created about doctors, or whatever negative things are going around about doctors, this platform can provide us a good place to undo that and recreate a faith in the doctors. I think this is a very, very, very good event.
I think it was a good event today, and a lot of interaction where a lot of positives came out across several facets of pharma industry, across several facets of medical practice, and I think a lot of action areas have also been elucidated during the course of the day's discussions, and I think that's good to take it forward from here on.
The evening award ceremony was marked by the presence of the top business leaders, industry stalwarts, politicians, eminent healthcare leaders, and medical professionals. And the award winners are Careworld TV got an appreciation award for the media coverage in healthcare sector. This award ceremony will result in significant opportunities for pharma companies operating in India to reach out to the global and domestic market.